Next speaker is Dr. Henry Tazelaar, and Henry is a lung pathologist and also chair of the Department of Pathology here at Mayo, Arizona. His topic today is going to be, when is interstitial lung disease not usual? Henry?
Thanks, Vij, for the introduction and for the opportunity to be here. Dr. Vigiano asked me to talk about UIP, NSIP, and chronic HP. So that's kind of where we're going to head with this talk. My disclosures, but I won't be talking about treatment or anything like that. You know, we've made a lot of progress in talking between radiologists, pathologists, and pulmonologists in the arena of the idiopathic interstitial pneumonias, but we still have some problems. Under the category of the idiopathic interstitial pneumonias, some are not idiopathic. Some are not interstitial. And in that sense, diffuse lung disease is probably a better term, but that hasn't quite caught on as a moniker in the literature in classification schemes. As you're well aware, the clinical terms and the pathology terms are not always the same. That's a problem. And many have a variable course. Some are acute, some are subacute, some are chronic. If we get down to the microscopic level, the challenge that pathologists have in classifying these is that the diseases we're talking about are comprised of a combination of inflammation and fibrosis. And it's often the quality, not the quantity, that allows us to make one diagnosis over another. And as already has been alluded by Dr. Gotway, overlaps are common. So foci of organizing pneumonia in nonspecific interstitial pneumonia. I can make a diagnosis of a cellular interstitial pneumonia on a cryobiopsy or on a transbronchial biopsy and say, you know, if everything fits, this could be NSIP. But you could have missed that area of OP on your transbronch, and I can't tell you that, you know, there could be OP next door. So it really could be organizing pneumonia. So on a transbronch, I tend to use the word cellular interstitial pneumonia rather than saying nonspecific interstitial pneumonia, because that to you means I'm making some sort of a specific, nonspecific, if you will, diagnosis. And then, of course, some patterns can be seen in other diseases or due to drugs. So we'll briefly take a look at the classification, and mainly so that we're all on the same page. I know you've probably all heard this, but I know when I speak to pulmonologists, most people don't do ILD work. Most people see asthma, COPD, lung cancer. So I want to make sure we're all talking about the same thing. We'll talk about what UIP looks like, and I'll pick up off of where Dr. Gotway left off. When is it? And then we'll ask some questions about when an interstitial disease